Dear friends, happy. We are seeing you once again for Saturday evening meeting. So this is a great occasion for us that we have கொஞ்சம் நிமித்துக்கணும். உடைஞ்சிடாம பரவாயில்ல, இந்த அளவு adjust பண்ணிடலாம். நல்லா இருக்கு. So we have happily finished happily finished 1424 cases on Saturday 13th July 2024. We personally feel this is a great achievement by us. Definitely many people are doing extensive study on puberphonia. And we are happy. We are not only treating the patient. So this is our 10th publication in the international journal of Emerging Technology and Innovative Research. It is a monthly issue. This is we have published on June 2024 in volume 11 and issue 6. If any ENT surgeon, anyone in the world, if they want to see our new publication in puberphonia, they can Google it and it will come in the Google. It is a online journal, open access, peer reviewed. Many doctors have reviewed this article and approved. So this will be a referral journal. As I told you, our work is not only just finding out the puberphonia boys and treating. It is a research and telling the world what you are doing, what we are doing. So they have to refer only our work. See that topic, a new puberphonia voice index to assess the quality of voice to fulfill the personality traits. So we have put forward a new voice index. The author are Dr. Navin Bharat. He is the assistant professor in Siva Medical College, Chennai. And myself, Dr. M.Kumaresan, ENT surgeon, Siva ENT Hospital in Triplicane and Lloyds Road. This is our research work. We are publishing almost every 6 months. We are tabulating our research because all the cases of 1424, we are having case sheet. We are having what is their voice pitch before treatment, after treatment. Somebody will be wondering, are you really having 1424 case sheet? Yes, I am having. We are having in Siva ENT Hospital. We are having the case sheet of 1424 cases. Their address, phone number, everything we are having. Their consent. Everything we are having. I am assuring you. So why I am keeping it, because few people are having a doubt whether 1,424 cases are available or not, because it is a rare problem. But Kumaresan says it is a common problem. So I am lucky. We are able to treat more number of Puberphonia in Chennai, Tamil Nadu. That means we have changed their life. That's all. So how much of people needs this service? Think it over all over the world. So it doesn't stop with treatment only. The research what I am doing. So you will wonder, this doctor is telling research. For Puberphonia, we formed a new voice index because old index are there for change in voice only, not in Puberphonia. This, you look at the article, what we are following. When I was a student and professor of ENT at Stanley Medical College, Chennai, we are following only GRBA scale. How to assess the roughness of a boy, roughness of voice. Voice problem is there. How will you assess? The assessment is GRBAS scale. That means what is the grade, what is the roughness, what is the breathlessness, what is the asthenia, or how much strain, how much instability. But I had a feeling this is not sufficient at all for Puberphonia assessment. So we have formed a separate index for assessing the quality of voice for Puberphonia, a new voice index. This voice index also, we have given the name as Kumaresan Voice Index. What a wonderful thing. In an international journal, we have published Kumaresan's Voice Index for assessing the quality of voice for Puberphonia. Because the original scale of GRBA scale doesn't fulfill the problems of Puberphonia voice assessment. That is the roughness and other thing, it is the scale. But in Puberphonia, this scale is not much necessary, I can say. So we formed another scale, our own research, with assessing completely 1,400 cases of Puberphonia. This we call as Kumaresan Voice Pitch Index. So all over the world, now they want to assess the pitch and formulate an index for the same, few people may be interested in following as our index. It is namely Kumaresan pitch index. It is not on roughness, not on the gruffness of the voice. It is calculated as the symptoms enumerated by the Puberphonia boys. This is the real symptom, what they are telling. 1,400 cases we have analyzed and put it into the table, what they are telling. They won't tell that my voice is rough. They will tell when I talk, it is inaudible for the listening person in phone call or talking. They simply says, repeat. But I know their main problem is female voice. That is why they are coming for treatment. Pure Puberphonia boys, they will be assessed as normal in the family circle. In the front circle, they will be called as having child voice. But in phone, they will be recognized as a lady. But they will come and tell us, my sound is not audible. If it is more audible, immediately they will be perceived as a female only. I hope you will be able to understand. So thereby, they will reduce their talk volume. So simply they say inaudible. That is 27% inaudible. The other 22%, my voice becomes fatigue. I am not able to express what I want to tell. The next one is, my voice is child voice. So they say it is not their mistake. It is a child voice continuing. That is 100% correct. So they are recognized as female voice. Then 9% will have double voice. Diplofonia. This is colloquially I can say the great man M.O. Radha voice. He will have a double voice. The double voice, now I am writing another article which will be, I have to work for 6 months. It is not, even though I am having 1,400 cases of puberphonia, now I have to segregate who are having double voice. I am having the list. And I have to refer at least a minimum of 100 articles on voice. I have to read it, take a note, and tabulate it, and bring to my mind my work, my research, my thinking. Then only I can put forward as a research paper. So it may take 6 months. My next paper is double voice diplophonia. This is very, 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 very interesting. I am going to tell one secret. The diplophonia, double voice, was recognized and written by a great doctor in 1837. In 1837, a doctor recognized double voice, diplophonia. So, diplophonia, recognized by a doctor, and 27 years later that only, the two type of voice occurring in speech of a same person in different pitch, and the name they had given diplophonia 27 years later only. So they have taken 27 years to name that. So definitely for recognizing Kumaresan pitch index, today is 2024. If the world has to recognize it, it will take 27 years. Okay. But the double voice, very funny, because I am doing research and referring article and perceiving the double voice from Puberphonia voice. One voice is Puberphonia and another voice is normal. That is called as double voice. So this is already told. You may wonder, this is already told in music. That is the great thing. In music, this double voice is very common. So they have already tabulated the double voice, but they don't know where it come from. So this is a great thing. Diplophonia, even though it is there written in 1836 onwards only, but it is recognized long back. We should be able to understand. So that is why I am just going on thinking and telling this voice therapy is more an art. That means singing, people already recognize that. So in 1837, the great man, researcher Muller, described the occasional occurrence of two pitches. He felt how these two voices come. for a person. It is a double voice. So this is coming from the vocal cord. Replicates. So it depends upon the vocal cord, different tension between the right and left. So he felt the two frequency voice are produced simultaneously. So one he named as falsetto voice and another he named as normal voice. In 1864 only, the great researcher Gibb, the original man is Muller, Gibb only given the name as diplophonia. So my feeling is mutational falsetto or puberphonia, they have recognized and noted in 1827 itself. But before that, another music people, they are in a German music team, Rosbach. He also described about the double tone. They called us diphthony. Diphthony. So that is there even before 1837 itself. Diphthony, diphthony. Two voices. Singers they have found out. So diphthony is described in many literature. They are all not ENT people, but music loving people, music teachers, Rosbach, diphthony. I am very interested in reading that book. So many times I have read the book Diphthony because two tongue voice, Tony, diphthony, two tongue. Probably this word, my feeling, almost should have come from Nak. It sounds like that. That's what I can say. Still, we have to do research on this topic. So, diphthony is told by German people of music loving people. Rosbach. So they also describe the same phenomena. They also contribute the same. See, what originally Muller says, it is the problem of vocal cord. Two vocal cord, ventricular band, so two voices, two pitch comes. But in Diphthony, Roseback view is these two voices occur because of the tongue, not because of the vocal cord. Probably one may be from the vocal cord, another may be from the tongue. So this is only described as a art. Double pitch phenomenon. Here I am thinking it is a double pitch phenomenon. It should arise from two separate, distinct oscillator. If somebody is hearing this, they should be able to help me. Double voice means two separate oscillator which produce sound should be there. That is what my research. Double voice, one voice is produced by the vocal cord, another voice is produced by the short palate or uvula. That is why you are having double voice. Not by simply the vocal cord. So our research is completely correct. Vocal cord make female voice predominantly, pharyngeal voice, the voice produced by the soft palate, and uvula predominantly male voice. But the public and the ENT fraternity will take, I am sure, they will take it positively 27 years later. I have to wait for that. Even though I have formed a small voice index, pitch index for Puberphonia, in depth you go, my finding will be correct. If you trace how voice is produced and voice is recognized in 1837. So that time onwards, recorded evidence are there for two pitches produced in human being. One is high pitch and another is low pitch. Until Roseback, who invented என்னமா உடனே 5 நிமிஷம் தான். So when Puberphonia, it is similar to the two voice in diphthony. So diphthony also two voice, two pitch. So this also two pitch, two voice. So it is clearly told one pitch is produced from the vocal cord and another pitch is produced in the soft palate and uvula. That is the vibrating mechanism. We have to do lot of work. I hope I will be able to publish the next paper in 6 months' time, where I have to read at least 100 articles. I pray God, the Almighty, give strength to me to read all the referred books and literature to say double voice is recognized long back. Thanking you, great. We'll see next Saturday, great. Thanks for all the people who are encouraging me to do this work. So today, happily, we have finished 1,424 cases of puberphonia on this Saturday, July 2024. Thanking you. Great. We'll meet next Saturday. Great.